Hey Adrian, how's it going? Yeah, thanks for all this information. Yeah, sorry you're still dealing with some annoyance in getting a comfortable gym set up. On this topic, like um, if you end up with like a sort of a weekly structure where you need um, certain exercises to be on certain days to fit that schedule, just let me know. We have, because we're not really doing like powerlifting stuff, we have a lot more flexibility to just move stuff around a bit. Um, As for the tempo deadlifts, I think like the most important point here is just this, and so thank you for just being honest here, like and stating that. I think it's if you're not enjoying it, I don't really want to give you the exercise. I think like um, the point here, I was not intending this to be an exercise that you can just push hard on, right? Wasn't really the intent. Um, Almost like the opposite in a way, right? I wanted you to be able to do because like I think there's always a risk with something like sumo or like a low bar squat or like even bench, right? That because it's such an extreme position, the load there might be driving some kind of like injury pathology. So I kind of wanted to try to strike this balance between maintaining the pattern but not really having much load. Um, but ultimately, if this like combination of stuff just isn't really working, then I think we kind of should sub it out. And ultimately, as well, and this is maybe one to think about, um, because maybe sumo doesn't really have a place in this sort of like period of training for you, um, because it's just a rubbish hypertrophy exercise. It's just not good. Um, it's potentially quite fatiguing. Doesn't have good range of motion. You're not going through a large range of motion through any of your joints. So, and again, it does have this like, if not direct injury risk, but kind of like pushes you, particularly with sumo, um, pushes you into this like externally rotated pelvic position, right? Which we're generally trying to move away from and try to like open up this like posterior lower side of your pelvis, right? Um, so I think maybe for you it's just not a great fit for right now. But have a think about that. Like it might be a bit difficult conceptually to let that go for a period. Obviously, things can come back, but I think maybe that's where my recommendation lies. Like after this block, um, I'll maybe leave it up to you as well whether you. I think my preference would be to stick with the tempo for this block. But if that's like you just don't see the point in that, um, then maybe just do some regular sumo in that slot if that makes sense. The other thing that could be kind of cool as a different challenge is to just try doing some conventional for a bit, because just biomechanically that's a little bit more neutral, and might feel a little bit more like like a bodybuilding type stimulus. Not again, not a great exercise for hypertrophy, but better than sumo because of the greater range of motion, and might be a nice opportunity to kind of practice good positioning through core and kind of like good use of your brace and all this stuff, and is more similar to like an RDL in its ability to kind of like have a good um, amount of kind of range of motion through your pelvis as well. So it's not just stuck in this externally rotated position. So maybe have a think about that, because it's also a good one I think anyway. As like just go to the gym and push, and it can be relatively agnostic to gym equipment as well. Like if you're not caring about powerlifting, you just do it on whatever bar. It's kind of just hard, whatever you're doing. Um, you get less of an advantage from a bendy bar with conventional. It just ends up being quite different depending on the bar. So as long as you're consistent, it perhaps doesn't really matter. But anyway, so just have a think about that. Yeah, with the dips, the leaning forward to target the chest, I know that's a thing, but it just has to be that you're, well, it doesn't have to be anything, but it's most safe for your shoulders if we can stay congruent between in like the the neutrality of your spine, right? Making sure that we kind of have this neutral spine up to the base of our neck, up to the base of our head rather. So yeah, I'll take a look at those as well. But let's see how we're doing. But I think yeah. So just in summary, I think with even with something like bench, and I think bench will be one that you want to do, but just to kind of include it in this bucket of things to think about. Bench obviously is, well, you do bench, you like bench as a powerlifting movement, right? We could do bench as a non-powerlifting movement, but then that wouldn't be really that great as a hypertrophy exercise, right? Because it just isn't. Because again, range of motion problems, slightly higher injury risk. But I kind of suspect that you'll want to keep doing bench for the sake of the numbers, and I'm not, deriding that choice. I think that's absolutely valid. So I think just think about these things. Similarly for squats, like not necessarily the best exercise for hypertrophy. Probably my favorite sort of like squat pattern based hypertrophy exercise would be like one of the proper like hack squats on a sled. Those are absolutely fantastic for like squat based hypertrophy, or like leg, like quad dominant squat pattern hypertrophy. So I think have a think about these things, and maybe have a think about those gyms where these pieces of equipment are, and we can have a bit of a like better holistic plan for this for these exercises. Cool, very nice. And a fair enough point as well with the straps. I think like in the fullness of time, I would say you could get used to straps. It would just take a few weeks of like being really stubborn and strict. And again, you get used to the difficulty of these pretty quickly. I mean, these look actually really really good. Not quite the right tempo, but like really good. And if we were in like powerlifting mode, I would say like probably these are really useful for you because they're really hard. Cause we've identified something that is really hard no matter what the weight is. So that means there's something that's disproportionately weak, and therefore quite good to work on. But as I said, your enjoyment I think is the most important thing here. I think your arms are looking bigger, by the way. Maybe I'm crazy. Yeah, I think actually those are a lot better this week. And if we were to stick with them, I'm sure you'd find it more palatable as the weeks went on as well. Good. I think just be mindful here that this is like the minimum depth that we should be getting. I know, like, I keep saying not to aim for too much depth, and that's still true. So, but like as you're doing a set, and really as you're warming up, we should be trying to push the hips back as much as possible. Maybe this angle is a bit punishing as well on the range of motion here, and also head position. But yeah, just to call out, maybe the depth is fine, but just always in the back of your mind to be going as deep as you can in terms of getting the hips back as far as you can, and then the depth is whatever the depth is at that point. So this is fine. So yeah, I think just to be really clear, I don't mind you leaning forwards, right? It's as long as the leaning forwards doesn't end up looking like this, right? So you can lean your torso forwards and do this, but I don't want to see that happen, where like you're kind of compressing through the upper anterior ribs a bit too much. But yeah, these do look better. I think if we, to make a deal here on including them in the next block, if we can, keep adding, maybe like next week add a tiny bit of weight, 5-10 kilos or something. Doesn't look like you're not telling me anyway of any pain or soreness from these. That's a really good sign. Let's just test this thoroughly, because the last thing I want to do is like create a new injury, right, with exploring a new exercise too quickly. But yeah, feel free to kind of like tip your torso further forward. Just make sure your head stays neutral, which is you're doing a good job of here. Cool, awesome stuff, Adrian. Yeah, let me know on a couple of those points, yeah, let's iterate this block, because if you're recovering fine. Oh yeah, just to make, because you commented here on kind of like how much volume to do. It's actually not necessarily the case that more volume is better, or rather, if you imagine that, like, because it kind of is true, but there's a very long curve, right, of like, or at least that, I think that's what the literature says, that like there is a dose dependent response with with volume and hypertrophy, but if you've plateaued like here, what's the point of like doubling the volume to get a tiny bit more effect? It's worst case example of like it being a waste of time and a higher injury risk, right? So what we should be doing through this process of focusing on hypertrophy is titrating, and just adding a little bit here and there, and then seeing where we find a sweet spot. It's not the case that it's like measurably the best, I guess, to be like banging up against the door of like maximum recoverable volume. Yeah, and it also depends a little bit on like how you define volume, how you define like well, that's more of a powerlifting thing, how you define a set. But because, for example, if you did 2 sets of something at RPE 10 and it was a genuine RPE 10, that may per individual may be more effective volume than doing 4 sets at RPE 6, say, So it's a case of kind of just working out what's going on here, and iterating through this process. Anyway, I've waffled on for quite a long time here, but hopefully all that makes sense. And yeah, so I've given you a couple of things to think about, so try to feed those things back to me. Let's get to the end of this block, and then we will change things up, and keep moving forwards and get you jacked as fuck in the next 3 to 6 months, I guess, is the target. Anyway, thanks again for all the information, Adrian, and the videos, and I'll see you next week.